Who doesn't love swimming? Everyone loves to swim, but swimming in pools during summer months, there could be some health concerns that you should pay attention to. Dr. Michael Stone is here from the ENT Consultants. He's going to talk about some of the dangers of what they call swimmer's ear. I have to admit, I have never heard that. That is a real diagnosis, isn't it? What is it?
Correct. Swimmer's ear is a very common problem. It is basically an infection of your ear canal. We call it swimmer's ear because it's most prevalent in the summer when water gets in your ear, but it can happen year-round because of these things, Q-tips.
All right. He has a prop
people put in their ear and cause abrasions of the skin, and that causes bacteria to cause infection.
I'm going to get back, but the Q-tip, you do recommend using the Q-tips?
No,
right? You don't?
Q-tips keep me in business.
Well, seriously?
You do not need to clean your ears. Leave your ears alone.
Wait a minute. You don't need to clean your ears?
No. Wax is actually good for you. It prevents swimmer's ear. The only reason to get rid of wax is if you can't hear. And if you can't hear and you're all plugged up, you come into an ENT office and we can clean your ears out.
You just put
Learn something new every day.
You put the whole Q-tip business out of business. Let me ask you this: when I go to swimming, sometimes I get out, and I get plugged up, and I have to. That's
right.
not. Is that a problem?
Yeah, that is a problem. Water gets retained in your ear, and that's a setup for infection. The best way to get rid of that is to put a mixture of rubbing alcohol and white vinegar in your ear, a few drops. Or they make a product called swimmer's ear, which is basically rubbing alcohol, and you put a few drops in your ear and that dries it out.
Or can't you just like step up and down?
You can do that too. You can put a hair dryer to dry out the fluid as well.
Really?
Yep.
What are the problems? Swimmer's ear. If it gets too bad, what happens?
Well, swimmer's ear is very painful, and a way for you to tell if you have swimmer's ear is just to pull on your ear. And if you do that and it hurts, then it's likely you have a swimmer's ear.
Any other symptoms?
And the other, really pain, fullness, sometimes itchiness, but really pain is the big one. And that can spread to your outer ear, to your face, and it requires immediate medical attention.
How do you treat it?
Well, you basically treat it with just ear drops. And an ear doctor or an ear, nose, and throat doctor is aware of that. If you go to an urgent care or an emergency room, they'll likely give you oral antibiotics as well as an antibiotic ear drop, and that's kind of overkill. And
is it long-term? Could it cause long-term problems?
No, it usually is intermittent, so once you treat it, it's gone. But some people who are immunocompromised, who have a weak immune system, it can lead to serious complications.
Any difference, real quick, between swimming in a lake versus a pool?
A lake is much dirtier, more bacteria. A clean pool, you should be okay, as long as you don't use these. I've never understood that. Yeah. Unbelievable. Dr. Stone, Michael Stone. That's it.
Thank you. We're done. Isn't that something? You've given us all this good information. I appreciate that. Thank you, Doctor. I never knew this. Thank you.